Well, Kathleen, after going over your medical history, risk assessments, and completing the oral exam, I just wanted to ask you a few things. I know I showed you already on the radiographs where you had that abscess and where you had a few new carious lesions or cavities. I just wanted to ask, do you feel like your new medications are working, your Xanax and your...
Yeah, I mean, I kind of just started them, so they're still kind of working and stuff, but they're getting there.
Okay, and could you tell me about your habits that you told me about before?
I smoke 2 packs a day, and I drink alcohol, and I'm really depressed, really depressed, so that's why I'm on the medication.
Do you feel like the medications are working better for you now that you've tried them?
Yeah, I do.
And do you feel like maybe the other habits were from before you started the medication?
I think so.
Okay. Well, were you at all interested in possibly reducing those habits or quitting even?
Yeah, I've thought about it.
Okay. Well, I just wanted to talk about today, if it's all right with you, were you interested in knowing about your new cavities that you have in your mouth? And you said you were experiencing dry mouth as well?
Yeah.
Did you want to go over those topics today?
Okay.
Okay, well, I know that you said that you like alcohol. Could you tell me more about how much you drink and what you drink in particular?
I drink every night, probably about 3 glasses of wine. Weekends it's a little bit more when I'm with my friends and everything.
Well, I know that most people don't realize, but it actually reduces the pH in your mouth with caries. You really want to watch out for wine, even beer as well. They're just very acidic, and wine in particular has fermentable carbohydrates in it. So if you're drinking 3 glasses a night, you're increasing your exposure, acidity in your mouth. Your enamel actually starts to break down and demineralize, and that allows the cavities to continue and progress. So you want to stop that, and drinking can also contribute to your dry mouth. The side effects of the Prozac and the Xanax both are xerostomia, which is dry mouth.
Okay.
And we obviously don't want to affect the medication that your doctor prescribed for you, because especially if it's working well for you.
Mm-hmm.
So we want to try and eliminate the other risk factors, which would be the smoking and the drinking. Smoking and drinking reduces your immune system response, which that can contribute to the caries as well, fighting off bacteria, and that can lead to periodontal disease. So we do want to try and eliminate those, and it's great that you want to quit. And I do want to remind you also that those are 2 of the hardest things to try. But if you just try and stay on track, we can give you a large calendar, maybe set up some goals, and maybe a quit date too if you feel like you're ready. We do want to also refer you out to a doctor because of your new caries. You said you didn't have dental insurance,
Yeah.
but you have an abscess, so we definitely want that to be taken care of.
Okay.
We have pamphlets on our free clinic, and I'd also like to give you a few pamphlets just talking about smoking triggers, your alcohol intake to a drink a night, maybe cutting that back to once a week even.
Okay.
If you feel like that is hard for you though, there are support groups available, or even AA meetings if you're interested, just to talk to people about that.